Well, as a youngster, I wanted to become a doctor. And then in my sixth year, my first student intern year at Tygervalley Hospital, I studied through the University of Stellenbosch. I was training to do general anesthesia, and I was put into the ophthalmic theatre. And whilst watching the surgery and doing the anesthetics, I became totally fascinated by the eye surgery and the beauty of the eye surgery. I wanted to learn techniques which weren't available in South Africa. So I decided to go to Europe, to the UK, Canada, USA, Colombia. I also had, from early in my career as a private ophthalmologist, I had a vision to start my own clinic. Cape Town didn't have a proper ophthalmic surgery unit, so I developed an ophthalmic surgery unit at the N1 City Hospital. And after 5 years, there was some other clinics that developed in Cape Town, modeled on the N1 City unit. And then I decided to start my own and found my own clinic and plan it according to what I thought was the best way to practice. I think my clinic is very well equipped, and a lot of the equipment that we've got for the clinic, we were of the first in South Africa to acquire the technology. I've imported many such technologies before they've actually come to the market. And this has placed our clinic in a very unique situation. In the early days of LASIK, we found a certain complication that was taking place in patients, and there wasn't a technique to solve this problem. And I developed a technique, and this was published in the Ocular Surgery News, and soon this spread throughout the world, and I was invited to the American Academy of Ophthalmology meeting, which is the largest meeting in the world. I've been invited to Italy a few times for live surgery, as well as the Rothschild Institute in Paris, and presented this work as well at these meetings. What I enjoy about cataract and refractive surgery is that it often gives the wow factor to patients. A blind person suddenly sees, or a person seeing poorly sees better the next day, and patients are very grateful, and this is very gratifying in my job. Every week in October, we do patients that are people that don't have the means to go to private clinics, and we help these patients, and we get sponsors in. And I basically give my time, we give the clinic, and I give my resources to help these patients. And I think that is giving back to the community and to the profession. In October, we are doing a golf day so that we can raise funds, so that if somebody comes along and needs help, we have the funds to help this patient. We would like people, the general public, patients, and the corporate people to get involved in this very, very important drive to raise funds to help somebody who's blind. Most importantly is to involve young ophthalmologists into my clinic so that I can teach them, so that they can continue doing the important work. There's a website. We have our own website. It's www.eyelaserclinic.co.za, and they can contact the clinic directly at info@eyelaserclinic.co.za.